Well, every day that goes by during this pandemic, cases of cancer are being missed. The diagnoses aren't there because people are not getting the proper screenings. Joining us now to talk about that is Dr. Jeffry Nestler, Chief of Gastroenterology at Hartford Hospital. Doctor, thank you for being with us.
Thanks for having me.
So tell us about safety protocols and measures in place at hospital units and ambulatory surgery centers right now.
Sure. The concept is creating a COVID-safe environment. So for all of our ambulatory surgery centers and hospital endoscopy units, what we do is symptom screening and temperature checks for all patients prior to coming in. We also have pre-procedure COVID testing prior to the scheduled procedure. The patient is dropped off and brought right into the pre-procedure room. So there is adequate social distancing. Everyone is in appropriate PPE, including the patient who's wearing a surgical mask. They then proceed into the procedure room. We perform the procedure as per our standard protocols. The patient is then brought back into the post-procedure room. The procedure rooms are then cleaned and disinfected, and the patients are discharged right to their car, to the ride at the street level. So we're trying to create an extremely COVID-safe environment. And to date, in the last 2 weeks, and all of our pre-COVID testing, we've had 0 patients test positive for COVID, which is extraordinary.
Okay, that is good news. So we hear that diagnoses of GI cancers have gone down dramatically during the pandemic. Can you talk about that?
Yes, across the country and at Hartford Healthcare as well, we've seen a 60% decline in the newly diagnosed GI cancers, and that's primarily from delay in diagnosis. Patients over the last several months, our units were essentially shut down, closed, and we weren't able to provide the screening procedures that is necessary to diagnose colon cancer early, or all GI cancers early. So we've had a number of patients that would have come in for the procedures, got diagnosed several months ago, and now are coming back to have their screening, their procedures, and get diagnosed at the current time. The issue with this is that we know with colon cancer, early diagnosis has a 90% cure rate, 5-year survival rate, and when you get to the later stages, if there's a delay in diagnosis, it drops down to 14 or 15%. So it's very important to have these screening procedures.
Okay, let's talk about the number of screenings is down an alarming 90%, and we all know how important the screening procedures are. Tell us about that. Oh, we just lost the doctor. Okay, it looks like we lost our Dr. Jeffry Nestler. We thank you for time.